Hi, hello, welcome to everyone. This is our channel Medical Madness. Today we are going to discuss about blood pressure, types of blood pressure, how to measure the blood pressure and the medical management of blood pressure. First, we need to know what is blood pressure and the normal value. Simple definition of blood pressure is the amount of blood enter into the arteries from the heart and the normal value is 120 by 80 mm of Hg. Then we will see the types of blood pressure. There are two main types. One is hypotension, that means low blood pressure. Second one, hypertension, that means high blood pressure. The blood pressures are mainly based on the cardiac output. If there is any problem in cardiac output, it will alter the blood pressure level in our body, either hypotension or hypertension. Okay, next we will clearly discuss the types of blood pressure. First one is hypotension. That means the blood pressure level goes below the 90 by 60 mm of Hg. If anyone goes into the hypotension in front of you, tell them to take more oral fluids. It will helpful to improve the blood pressure of them. Otherwise, if it is a hospital settings, they will correct it with the IV fluids. In case if there is a emergency situation, we can't able to revert him with the IV fluids and the oral fluids. Doctors will prescribe the inotropic agents like injection noradrenaline infusions. During the noradrenaline infusion, we need to monitor the blood pressures in the regular interval. If the blood pressure goes very low in our body, it will produce some symptoms like dizziness, fainting, blurred vision, nausea and vomiting, fatigue, cold and clammy skin, rapid or shallow breath. Okay, next we will move to hypertension, high blood pressure. There are four main sub-classification in the hypertension. First one, pre-hypertension. Second one, hypertensive stage 1. Third one, hypertensive stage 3. Fourth one, and the finally, third stage of hypertension is called hypertensive crisis. First, pre-hypertension. That means our systolic blood pressures are in the range of 120 to 139 and the diastolic pressures are in the range of 80 to 90 mm of Hg. It may happen due to heavy physical activity. Second one, hypertensive stage 1. In this stage, the systolic pressures are in the range of 140 to 159 and the diastolic pressures in the range of 90 to 99 mm of Hg. Third one, hypertensive stage 2. In this stage, the systolic pressures goes above 160 and the diastolic pressures goes above 100 mm of Hg. In stage 1 and the stage 2 hypertension, doctors will prescribe the oral antihypertensive medications to correct the hypertension, like tablet amlodipine or tablet metoprolol and etc. The final stage of hypertension is called hypertensive crisis because it's a medical emergency. That means it requires immediate medical management and proper observation. Sometimes it may settle down with the oral medications or it needs an antihypertensive medicine infusions like injection nitroglycerin as per doctor's order. If the blood pressures goes very high in our body, it produces some complications like stroke, heart failure, vision loss, kidney and sexual dysfunction. Okay, now we will clearly discuss about how to check the blood pressure with the BP apparatus. It's called sphygmomanometer. Before checking the blood pressure, ask the patient to take deep breath and relax for 5 to 10 minutes. Because if you are checking the BP after immediate walking or any other activity, it will show wrong readings like high or low BP. So tell them to sit for few minutes and check the BP. Now we will move to blood pressure measurement. After settling the patient, select the appropriate arm for checking the BP and connect the BP cuff just above the antecubital fossa, that means 2 to 3 centimeters above the elbow joint in arm, which shown in the picture. Once you fix the cuff properly, then gently increase the cuff pressure with the valve. Keep the stethoscope diaphragm in the antecubital fossa and listen the beats. At one point, you can hear the beats. It is a systolic pressure. Gently keep reduce the pressure with the valve in the sphygmomanometer bulb. Now you lost the beat. It is the diastolic pressure. For example, you start to hear the beat at 120 and you lost the beat at 80. Now you can tell your BP as 120 by 80 mm of Hg. Nowadays, your blood pressure monitoring is very easy with the digital BP apparatus without a stethoscope. Simply tie a BP cuff in arm and press the start button. Then automatically it show a BP in display. However, I want to say one thing. If you have any alterations in your BP apart from the normal level, it is related to your heart. Don't take any medications without the doctor's order or prescription. Thank you to all. I hope you guys are something know from this session. If you like this session, please like, share and subscribe our channel.